The midwifery practice I found to be very, I will call it like cagey with me after. They didn't want to talk about it very much. I did have the midwife come in and she cried the next day. In one hand, it was nice that she was feeling human. I was like, I appreciate that. And another, I was like, oh, I don't have any like capacity to comfort you right now. Like you're going to have to go get comforted by somebody else. It's just how I was feeling. She just was saying, you know, she admitted to me that she had never had anybody rupture in her care before, and that the midwifery practice really hadn't much either, and they weren't very experienced with it. And but they very much highlighted repeatedly, even in my postpartum checkups, we have no idea what caused it. It can just happen sometimes. We have no idea what caused it. It can just happen. Yep. It just happens sometimes. It stinks. It can just happen. It can just happen. And they like shoved that down my throat. And I'm like, I get that ruptures can just happen, but like they were kind of handling it almost like I was going to sue them the whole time. Cause they wouldn't talk to me about anything. And they just kept being like, yep, ruptures happen and onward we go. And we're, you know, so that was difficult. I felt like I can't even process this and understand it with my providers because you won't talk to me or give me any real tangible information. Like, so I feel like I can't understand it. I feel like I can't process it. I can't digest any of it because you're all treating me like at arm's length. So that was difficult. He did have a hard time with cooling. He had phenobarbital because he had seizures while he was cooling. So he had phenobarbital, and he had morphine to sedate him. One of the things about cooling is you're not really, they're trying to change this. They're trying to learn and evolve some of this. I'm part of an HIE network. And so I guess they're trying to really see to what ways hospitals can facilitate parents holding babies during cooling. Cause it's really just the fact that like, you need to keep that cooling blanket and you can't really, first of all, it is uncomfortable for babies if you touch them while they're getting cooled. It causes them to be like distressed and uncomfortable. And I didn't want to do that at all. So I couldn't hold him or really touch him even much while he was getting cooled. But so the NICU was great. They did try to get me involved in ways they could. So they'd be like, do you want to change his diaper? Do you want to take his temperature with us? Like, do you want to do these things? And they would try to involve me in what care I could do. And we had amazing care in the NICU. Fast forward when he was able to start like trying to latch to breastfeed, when he had his NG tube out and everything like that. The lactation consultant, a NICU lactation consultant, is just so different than any other ones because she was just kind of like, well, if he latches, he latches. If he doesn't, he doesn't. We can try this, but formula's good too. And however he needs to eat, you know, they're so used to just having so many sick babies in the NICU that they're just like, however babies get their nutrition, we just need to feed them. So whether they need to be fed this way, that way, or the other, you know, that's good. They're getting fed. And that was so refreshing to hear. So he had great care through the NICU. I really was disappointed. Like when I went even to my 2-week checkup to check my incision, I just felt like they were uncomfortable that I was there. I felt like they were avoiding having a conversation about it. So I did end up switching away from them back to an OB practice, but a different one that my primary care doctor had recommended. He said, here's one I really like. And he's like, I did some medical school classes with her and she's great. So I did switch and she was just so great from the get-go. So I did switch after that. I did write a letter to the midwifery group and I let them know where I felt like some of my care was substandard. And I wrote about things that could be different. To their credit, they did agree they reached out to me and had a meeting with me. We went to a Starbucks and had a conversation, and it was the midwife who was there when I delivered. And it was the lead midwife, and the lead midwife was the one that I always did like. I had a conversation with them. I talked a lot about how it was difficult for me to understand or anything because I couldn't even have a conversation with them. I did talk about how I felt I was ignored when I showed signs, and how that's problematic because some rupture patients don't even show any signs. And here I was having like full-fledged symptoms of a serious issue and I wasn't taken seriously. So I did share that with them. I shared with them that I felt like here I experienced this massively traumatic event and had a baby that nearly died. And, you know, just a massively traumatic experience for me, and that they just kind of like checked my incision at 2 weeks and gave me that like baseline, like, are you depressed? Do you cry every day? Like, you know, the screening that everyone who's truly depressed lies on. Let's be honest about it. Anyone who's really struggling with postpartum, I understand the screening tool and why it's used, but that's what I did try to emphasize. Like, I understand why you need a standardized tool, and I know why that screening tool exists. And if it helps one person out of however many, wonderful. If that helps facilitate a conversation or helps postpartum parents recognize that they are struggling, great. I was like, oh, I'm not going to say how I really feel because, and, you know, I just kind of had carried on. I said, I really feel like in a practice that big and in obstetrics in general and midwifery, that there needs to be partnered with those practices, mental health professionals that are routinely helping parents after they've given birth, like anybody who's maybe, if they've experienced loss, if they experienced a traumatic birth, if they may be going into their obstetric care have disclosed, you know, trauma in their life that could lead to like adverse processing of events and things like that. Any of those things, you know, I'm preaching to the choir, but yeah, I mean, we just need better postpartum care for parents. You go to the end of your pregnancy and you're getting, you know, checkups for the baby every single week, and then you give birth and they're like, okay, bye. And I felt that even more emphasized when I had a birth, that they were like, again, like, oh man, we let that happen on our care. And then I just was kind of ghosted by them almost, like they were like, don't want to talk about that. So I don't know. So that was kind of my main experience. And I did share that, and to their credit, they were receptive of it. I don't know. They did say, so they shared with me that, so first of all, the midwife who was on with me when I ruptured said that she thinks about it. And she said that every time she has a TOLAC patient, I'm in her head. And she said, that's a good thing for her. She said, it's good for me to remember you, and it's good for me to be aware. She said, and she's like, you know, at first I was really, really nervous every time I have a TOLAC patient. And she said, now I'm feeling less nervous about it. And I feel better prepared. And but she said, but you're always in my head when I have a TOLAC patient now, because she said there's certain ways I approach my care differently, which that's at the end of the day what I want. I want you to approach your care differently because you failed me in your care. So I do want you to approach your care differently. So if you're telling me, yes, I do that, then that's good for me. I'm not going to hate you for the rest of my life if you're telling me like these are the ways in which they did say as a practice that they have a TOLAC patient, they put them right next to, or a higher risk patient, they put them next to the OR. They said, you know, seconds count. And that was a lot more time tacked on, just having to wheel you that much farther. And so they said, you know, these are some of the things we do differently now. I don't know if they consider how much or how they use Pitocin. I know that it's considered reasonable, and some people will do it and some people will not. Some doctors, some midwives will, some won't. I don't know if they've considered. I would imagine that Pitocin played a factor in my rupture. It's hard to say, but I'm sure it probably was part of the cocktail of things that caused it. I think probably being predispositioned to having one of those labors that is like contractions one after another that really aren't productive though. I mean, I think my uterus contracting for hours and hours and hours and hours, and those intervals probably was taxing on it. I think all of those things, I probably had a multitude of contributing factors, but again, I was a perfect TOLAC patient on paper.
How long were you in labor from the time your water broke, et cetera, et cetera?
So my water broke, actually, it was my first pregnancy that my water broke first. My second pregnancy, my water ended up breaking towards the end. It broke at like 2 hours before I delivered.
Okay.
I started having contractions at 8 p.m. on October 2nd, and his time of birth was 5:30 p.m. on October 3rd.
So a while. Mm-hmm. How long were you laboring with your first?
20 hours.
Yeah. And you were only at 6. So yeah, she was like, "No, I don't think this is going anywhere." No, I didn't see that going anywhere either.
She was being gentle about it, trying to be like, we could try, but I don't think it's going to. I think you should probably just get some antibiotics and you stop feeling like you're dying right now.
Goodness.
So my question, I'm wondering, for people who have ruptured and for people who are facing with their babies a NICU stay because of that, how can the community support them? How can their loved ones help them during that time? There's some really stupid things people say.
Mm-hmm.
What would be the most helpful and practical ways that you can think of?
So for like immediate family, if there's other kids, like I had my daughter at home, like I was constantly preoccupied with like, I'm abandoning my child and like, I can't even, I'm going to be here so much longer and you're going to be here. And I'm, and so this idea of just knowing, like having people who are going to pop in and also will help. Like I was discharged well before Thomas. So, someone to come help me care for my, which really that's universal for all birth giving parents, really just need some help with you really could use help when you have little ones. I remember my first night, what my ex-husband and I did at that point is we were married at the time. We tried to we would swap who was at the NICU and who was at home, who was at the NICU and who was at home. And my first night home, he would come home to sleep, but he would stay like the evening. So I'd go home to be with my daughter. So the very first day after I was discharged, he brought me home and then went back up to the NICU. And I tried to give my daughter, she was 3, and I gave her like her bath and put her jammies on her and got her up to bed. And I just remember being like, oh my gosh, I had just had surgery not that long ago. And I was like, that was so exhausting. I am now in pain. I'm so tired. I just burst into tears. I was like, I don't know how I'm going to keep doing this while he's in there. So, and some of this might not be universal right now with COVID and the different precautions and who they let visit. I will say even at that time, the NICU had very strict visitation that you could pick two visitors. So you were allowed to have, the grandparents were always allowed to visit. That was allowed. And then you could have 2 visitors outside of that per day. I, to be honest, really didn't want visitors. I wanted to just spend time with my baby, and I didn't want a lot of people to see him that way because I felt like I couldn't manage other people's reactions to seeing him. He was connected to all sorts of wires. He was intubated. He had a PICC line. He had, a bunch of electrodes on his head. He had his little diaper, and that's it. And his skin was discolored from his cooling. It was purplish colored, and sometimes he would just spontaneously like shiver as he was there. And then he would I didn't want anyone to see him. I didn't want to manage their like, oh my gosh, when they saw him, like, I was just like, that's not helpful to me. Please leave me alone. So, I really don't want to see people. I remember when my mom came to visit, I told her that she couldn't, if she was upset, I was like, I understand you're going to be upset that this happened to me and you're upset that my baby's struggling. You have to like be upset somewhere else. You can't come be upset with me and I said, I know that might be unfair. I'm just telling you, I can't manage people's upset emotions right now. So that was one of my things. So I guess I don't know how to tell people to approach that. It's just know that like dumping your emotions on the parent who's going through it is not helpful. Snacks, bringing quick, oftentimes you're not allowed to eat in the NICU rooms themselves. So there's like a community room that you can go and have, like, you can get food delivered to the front desk and you can have it there. I didn't want to really be away from him for very long. So I liked things that were like, that I could keep in my purse and then just bring down there to eat really quick, like little sesame sticks and cracker and peanut butter and like, just things I could eat quickly. That's really helpful. I feel like to if you can deliver a bunch of snacks, really quick portable things, because most NICUs they oftentimes don't, you can't eat like right within the room. So, those are such small things, but they make such a difference. I remember just like my mom bringing me little portable things and I would run down. It was enough to like get a little a break and have my coffee and do things like that and like come back and I would feel like, okay, I'm a little more refreshed, but I didn't want to really be away from his room all that long. I wanted to be with him. I didn't want to have to like leave and go do a lot of things. So I would say that's helpful. And then also just for the things, one of the things that was, I got in touch with so HIE was and is his diagnosis. And I got connected with the official HIE network when he was an infant, called Hope for HIE. It's a very reputable, great organization. They do so many wonderful things. And I did actually, upon leaving, I had never heard of HIE in my life. I knew nothing about it. And I think most people going into having a baby with HIE don't know anything about it. So having people who can explain that to you and having almost like the materials. So one of the things that Hope for HIE does is they distribute NICU materials for free to any NICUs that want them, that are like, here's how to like, our new parents can access this group. Here's our little like tips. Here's a little bit. And there's like infographics, and they send, actually one thing Hope for HIE does is they send like care packages to new parents and stuff too, and all sorts of things like that. So I did put my NICU in touch with that, but that organization. So I think it does help when there's things like maybe that are lesser heard about, like, you know, to have that information or to have just those pieces. So being able to have a strong social network. And then I think the last thing I would say is I really liked sometimes being able to, like, if I was going to pick up the phone and call someone, I like to just like talk about like what show was on and, you know, what happened in that episode. And it was nice to just have some sort of like distracting conversation that wasn't around like my child's like vitals and blood gases and things like that all the time. And like when the next neuro visit was coming, like it was really helpful to just have like normal conversations too. So that was really helpful to me. And one thing that's tricky, because I will say that a healthy baby is the most important thing. That's the outcome. That's all that really matters. But if you've gone through, it's not helpful to hear like, well, at least this or at least that. And then like, as he recovered, it was difficult to hear, well, at least you and him are healthy now and things like that. I say like, so I rephrase it like, yes, a healthy parent and a healthy baby are what's most important, but it's not the only thing that's important. And like, how are you otherwise doing? How are you feeling? And things like that. Cause I remember just feeling like, okay, well, yes, at least he's discharged now. And now I just sit here and watch him breathe all night and make sure that he's not having seizures and doing this. And yes, I am forever grateful that I'm forever grateful that he pulled through and had the care that he had and all of these things. But that doesn't magically erase that, like all of the trauma I just experienced.
So how long was he in NICU? And you're talking about all these different ways. Were you getting the support that you needed? Or do you think there was a little bit extra that you think you should have had while he was in and maybe after too?
So he was in for a few weeks, and I don't remember the exact number of days now. I'd have to go look back at like old Facebook posts, because I know I did one that was like discharge day. So it wasn't a huge amount of time compared to like the amount of time that people with like micro preemies spend in the NICU. I mean, they end up spending half the baby's first year there sometimes, you know, or more. And so I can't say, I will say I felt very well supported in the NICU. There were social workers and really great doctors and nurses. And for most of a good portion of his time, he was one-to-one. So I had a nurse just there with me all the time because he had a one-to-one nurse. So I had like these nurses that we would talk about everything, because really they were monitoring his vitals, they were monitoring his cooling, they were monitoring all these things. They were giving him the medication he needed, and they were doing important work, but some of it was a lot of just keeping an eye on him and making sure he was stable. So he had one-to-one nursing. So I had great nurses that I did talk about all those things with, like, and what shows are you watching these days and things like that. And so I had those nurses, and the doc, I had an amazing neonatologist that oversaw all his care. I had the social workers that were popping by and making sure I was okay and I was well supported. And they had a couple of peer parent volunteers who would come around like once or twice a week, different ones. They were parent volunteers, and they would just come around and see how parents were doing. And they'd come and they'd say like, hey, are you up for? And it was just this nice, like, hey, I've been there type thing. And that was really valuable to me. I loved the parent volunteers that came through, and I loved just talking with them, and that was inviting to me. So it was when I went home that I really struggled. When I got discharged, I was like, oh gosh, I have to keep him alive now, which I think is something that like parents universally kind of feel like, oh, who put me in charge of this baby? Like that's a very common feeling, but it's more so, I think, because I had already been a parent before, it was elevated having nearly lost him. So being like, oh my gosh, how am I going to know? So that's where really, my postpartum mental health issues really started to resurface. I struggled with depression and anxiety outside of pregnancy at different times that I had had well managed over the years. And I did struggle with mild, but postpartum depression with my daughter. And then it really splintered out and got more severe after him. And I just, it really was more, it was less depression and more anxiety. It was a lot of anxiety all the time, but people, again, in not really noticing that there was much wrong, because they were like, well, of course you're anxious. Look what you just went through, which was validating and true, but also it was heightened. I really was my sleep was the most impacted. I really couldn't sleep, and I couldn't, I had him in a safe sleep environment in a bassinet next to my bed. I would check, all night long to see that he was breathing. I had this constant fear that he was going to just spontaneously stop breathing, or that he would have had a seizure while I was sleeping. So I'm not making up, because I would check my phone, I would pick it up and look at the clock. It was every 10 to 15 minutes all night long. And I did it for about 18 months. That's how severe it was. I just didn't ever sleep. And that was making me so unwell, so sick. And it was actually, again, talking about the care that moms and pregnant people don't necessarily receive after they've given birth. I have a family care doctor who sees all of us. And it was at his pediatrician appointment that our shared doctor was kind of like noticing, just like, hey, and then being like, kind of like, are you okay? And kind of getting me the help I needed, because otherwise I think I would have just flown under the radar. I was functioning. I was, at least on the outside to other people, I wasn't neglecting him. I didn't have any thoughts about harming my baby or anything like that. But I was just overall just very unwell. I wasn't sleeping. When I went back to work, I would go into the nursing mother's room and pump, and then I would just cry, and then I would put my makeup back on and come back out and carry on with my day. I was really just unwell all the time, and I was just having flashbacks, and I would sit up straight in bed. And it was so bad that at one point my husband was so irritated that I kept jolting up all night long. He was like, I can't even sleep. So he started sleeping on the couch, because he couldn't even be in the same bed with me, because he was like, oh my gosh. So he moved to the couch and all of that, because I never slept. I couldn't sleep. It was always like all those 10 to 15 minute checks were like jarred awake. So I was really getting really, really poor sleep, which upon retrospect probably put me in, I never did bring the baby into bed or anything like that. I knew safe sleep at that point, and that was important. But I do think it probably put me in vulnerable positions when I was like tired and breastfeeding him, like pulling him. I will say I did do the thing where I would like be sitting, I would sit like crisscross applesauce in my bed and nurse him like that. I always sat that way when I nursed. Like I never tried laying down or anything, but I was so tired when I was nursing him. I think even if I had been in a recliner anywhere or a chair or whatever, I do think I should have probably used different. I didn't know some of those safe sleep strategies that get talked about in the other group now that are so great, like, and not going in a place where you're going to fall asleep. I probably could have benefited from sitting in like one of my wooden kitchen chairs and nursing comparative or something, because I was so sleep deprived. So I did end up, getting support. I ended up getting counseling and a little trial and error with a med regimen, but I did get that as well, which makes all the difference. And then I really did. Time healed some of it, and that was part of it. But I did benefit from going to therapy, sorting through the trauma and processing it with an experienced professional, and not shaming about medication, getting a good med regimen when I needed it.